Dr. Sidney Wallace was and remains an iconic figure in the field of medicine. Dr. Wallace trained in Philadelphia and Sweden, after which he settled at the University of Texas MD Anderson Cancer Center, where he spent his entire career and led the Division of Diagnostic Imaging. A visionary in the true sense, he anticipated numerous concepts, some of which are now standard of care for cancer patients, and others which are still areas of active research. He, along with his partner Cesar Gianturco, were true pioneers of the field and were instrumental in the invention of many devices that form the fundamental principles of our specialty and continue to be used in clinical practice today.
A fellow who was an oil man who fell through a pane glass window when he was a little inebriated, and 3 weeks later he had a buzz in his ear. Psh, psh, psh. We obviously demonstrated the fistula, and Caesar was my assistant at that point, and we had a Teflon catheter. A long Teflon catheter, but not long enough because I couldn't get into the fistula from the femoral artery, so I had to go through the femoral vein and then went right up into the internal jugular and then into the fistula's tract and put a coil, the biggest one I had. It looked good for about a second, and then shortly thereafter it just gingerly and very artistically popped out of the fistula, down through the internal jugular, to the superior vena cava, through the heart, and out to the left upper lobe. And I turned around, and Caesar was gone.
His distinguished career spanned more than 4 decades, earning him numerous accolades from various international associations. Upon his retirement, Dr. Wallace founded a biomedical company to commercialize a cancer drug, Opaxio, developed in response to his sister's battle with ovarian cancer. The drug is currently in phase 3 trials. Following in the footsteps of his father, Dr. Michael Jeffrey Wallace was a second-generation interventional radiologist who also spent the majority of his career at the University of Texas MD Anderson Cancer Center. He spearheaded the creation of the Department of Interventional Radiology, of which he was named the ad interim chair.
Mike, from your perspective now as a second-generation person, did your view of interventional radiology change over the time you've been in it? Is it what you thought it was?
I don't think it's changed because I think, all along I knew what the possibilities were. I think what's obviously been more restrictive is the complexity of taking things from innovation to the clinic. Mm-hmm. But I think, my feeling has always been one of IR is a creative and innovative field, and the sky's the limit.
An advocate and early adopter of cutting-edge imaging innovation, he championed for the use of cone beam CT technology, which allowed for 3D cross-sectional imaging to be brought into a traditionally 2D angiography suite. In 2016, Michael's long-term dream of advancing the practices of tumor ablation and embolization were realized with the opening of a state-of-the-art facility at MD Anderson's Pavilion building. Featuring multiple hybrid interventional radiology suites with the latest technology, it was one of only 2 such interventional radiology departments in the country at the time. For this father-son duo who have made inspirational scientific and educational contributions to the field of interventional oncology, the Society of Interventional Oncology is honored to present the inaugural Dr. Sidney and Dr. Michael J. Wallace Distinguished Lectureship.